So there really just was one major issue that I wanted to address. You probably saw this in the news. The CDC has redefined what close contact exposure to COVID means. So previously, and we're all as employers, if we have employees in the workplace, we've been doing our contact tracing around the definition that close contact is being within 6 feet of an infected person for 15 consecutive minutes or longer. Well, as we know, all of this changes all the time because the science changes and we learn more. On October 21st, the CDC updated this guidance and said, well, close contact is now going to be within 6 feet of an infected individual for a cumulative total of 15 minutes or more over a 24-hour period. And obviously, that's just a lot harder as an employer for us to manage, to contact trace, to figure out when we do have a positive case in the workplace. You know, how do we, it's usually pretty easy to say, oh, I was having a conversation with that person within 15 minutes. And yeah, we were working on a machine together, so we were closer than 6 feet. But a cumulative total, I think, is going to be a lot more challenging to identify as an employer. And this also points out a really good issue that I was talking just to a member about just yesterday. We were talking about their health and safety plan. And should we take that health and safety plan and put it in our handbook as sort of a permanent addition to the handbook? I would probably say no. Now, maybe if you have an electronic handbook and you can make changes on a regular basis, but this is one of the reasons that you don't want to put this in print and leave it and expect to leave it there for months or a year at a time, because we're always going to have these changes. So from a practical point of view, a couple of things. When you do have a positive case in the workplace, contact trace, determine if anyone was within 6 feet of the infected individual for the cumulative 15 minutes or longer within the 24-hour period. You go back 2 days prior to the development of symptoms or the testing positive. And keep in mind, it's not when they get the positive test results, it's when they tested, because we know sometimes there can be a lag. And then the other part of this, obviously, is to be proactive, right? Let's try to minimize the amount of time that people are together cumulatively over the 24-hour period. So maybe we want to change the way we're doing small group meetings, the way we're handling some of the things we've handled in the past to make sure that we're not having any issues.
Amy, there was one.
Okay,
question.
and
There was one question that
sure,
came in.
go ahead.
It says that CDC says 15 minutes, and plenty of places on PA website is 15 minutes, but the business guidance still says 10, which we put in their health and safety policy. Are you and I know in the past I've heard different timing. What's your thoughts on that?
Yeah, I'm a lawyer, so being more conservative is never about safety, and especially if you're one of those workplaces where you have a lot of people in all the time, so you're manufacturing, and you have people in person. I don't think it's a bad thing to be more conservative than the 15 minutes and to make it 10 minutes. I think being more conservative is going to probably benefit you in the end.
And at the end of the day, it's like you said, you're trying to identify who you need to then put into a quarantine situation based on this. And that's, I would say you also want to be conservative there because you want to minimize spread if at all possible.
Right. Yeah, and I think it's not just about the contact tracing after the case, it's about being proactive ahead of time. Like, what can we do? Even, I think it's what we're saying, and we're heading into the winter and everybody's talking about this twindemic, talking about flu, we're talking about cases rising around the country, hospitalizations rising around the country. I think it's a really good time to take a look at your practices, especially as COVID fatigue is setting in. What can we do to be even more vigilant in our workplace to make sure that our folks don't get sick?
Very good. All right. Well, hope you enjoyed today's session. Again, this is one of the gray areas, and so it was a good dialogue. Thank you to Margaret and Amy for your insights there. As I said, we will take next Tuesday off and hope everybody votes, and we'll see you the following week with some tax and planning ideas. Thanks very much.